Welcome to Breaking Ground. This is a show about new health and health innovations that are happening in Lincoln, and especially about innovations that are being funded by the Community Health Endowment of Lincoln. Let me tell you just a little bit about the endowment. The Community Health Endowment was created back in 1997 when Lincoln General Hospital was sold. At that time, the proceeds from the sale of the hospital, or about $37 million, was put into a special endowment. Since that time, the fund has grown from $37 million to $56 million, and at the same time, we've been able to return over $15 million to the community to help support health and healthcare programs, and many of those things have resulted in new innovations for our community. Today, we're going to be talking about a new innovation in emergency and cardiac care and how it's helping people across this community who experience those events and who are able to get better care in our community. So we hope you'll join us and take the time to learn about how we're breaking ground in Lincoln with new innovations.
30 minutes a day of physical activity can improve your health and decrease your risk of heart disease. So start walking for yourself. Start walking with your family. Start walking with your friends. Start a movement in your community. Start walking. Start something. To join the movement, log on to heart.org/start and help start something now.
Thanks for joining us today. We're going to be having a conversation about an exciting new innovation technology here in Lincoln, and we're going to be talking to Ruth Rodensleben from Bryan LGH and to Pam Randall from the St. Elizabeth Regional Medical Center about this new innovation. So thanks for joining me today. It's exciting to hear about this. So I'm just going to jump right in, and I want you to tell me about this new cardiac innovation that's happening in Lincoln.
About a year ago, we started working with Lincoln Fire, St. Elizabeth, Community Health Endowment, and Bryan LGH to begin transmission of EKGs from the field directly to the medical center. Our goal for the process was to speed up the time from when the patient is identified in the field who is having a heart attack until they can get to the cath lab, because the faster that we can identify and treat a patient, the better they're going to recover, and the better their long-term life will be.
I think you've mentioned, I've heard you've talked before, time is tissue. Can you
Exactly.
tell a little bit about that?
Well, as I mentioned, when you have decreased blood flow to the heart, it begins to kill heart tissue. So the faster we can reestablish blood flow to all of the vessels in the heart, the better chance that the patient has for an excellent recovery.
So even seconds and minutes count in all of this, and that's why this is so important. So Pam, describe for the folks who are listening, and I think this would be of interest to anyone because we're all potentially ourselves or someone in our families who might need this kind of an intervention in this community. So what would a person before this technology experience as opposed to what they might experience now?
Well, over several years, it has evolved into, before this, a patient would arrive into the emergency department and we would do an EKG on them immediately. We would move them into an emergency department room, do an EKG on them. We would then the physician would then determine if they're having a heart attack. At that time, then we would initiate a hospital-wide process that would notify certain individuals that we have this type of patient in the ER and need to get them to the cath lab immediately. So that process has evolved over time into what I just spoke of. When the EKG started out in the fields, the 12-lead EKGs, which really shows different views of the electricity of the heart from different angles, and so they can do that in the field versus in the department.
And what you mean in the field is
out in the city or at their homes, wherever they may be when they call 911.
So the ambulance arrives, and that's where they're able to do this right in the home now.
So the ambulance, they'll determine the patient's having chest pain. They will do an EKG at the home or facility or wherever they're at. They will transmit that EKG through an electronic and software program to our department or to whichever receiving facility the patient wants to go to. Once that is received, we will print it off. We take it to our emergency physician. They immediately look at it and will call a cardiac alert, is what we call it in our facility, and pretty similar in both areas. And that is the process then that goes out to several individuals within the hospital.
And what I've also heard too is that this information can be transmitted, say, right to a cardiologist's phone if they don't happen to be in the emergency room.
correct.
Is that right?
Yes. So as soon as the ED physician determines that they are having a heart attack, they will send that to the cardiologist on call, and they get it on their phone, and folks start showing up in the department pretty quickly, because like you said, time is muscle. So.
Okay. Good. Now, what have you experienced just in terms of the results? I mean, I know there's going to be, I'm guessing, and what I've heard is that we've seen just a decrease in the amount of time from the time a person experiences their event to the time they get treatment. Ruth, is that?
There has been a significant decrease. The exciting part is what Pam is describing all is occurring before the patient even arrives in the emergency department. So thanks to the information that we're receiving from Lincoln Fire, a lot of decisions can be made, people can be notified, and the teams are arriving before the patient even gets to the ER. So the ambulance arrives, we do a very quick assessment in the ER, and they go straight to cath lab. So all of that assessment that was previously occurring in the ER has all been done by the time the patient arrives in the ER, and they go straight to cath lab, and it shortens that time and improves their chances of recovery.
All of that is happening while the person is being transported to the hospital
Exactly.
now, where before they were having to
Exactly.
wait to get there. So I think that's terrific what technology is doing. Well, I know as an endowment who helped fund some of this technology, one of the things that interested us was you all working together in putting this system in place. It wasn't just one of you doing it or the other or the fire department coming, it was as a group. So tell me, Ruth, about how that, in a time of competitiveness in our, in the healthcare arena, how that all came together.
Brian LGH and St. Elizabeth have worked together on a number of collaborative patient care improvements, and I think the City of Lincoln can be very proud of our healthcare system because we work so very closely together, because we have an excellent EMS system. We have very well-trained people in the City of Lincoln working in EMS. We are working very collaboratively with all of our units in Lancaster County and in other cities. So as we are seeing the improved care for the people in the City of Lincoln, we're seeing the same type of outreach into the county and into other rural facilities. I think we have an excellent system of care here as the result of very close collaboration and the support of looking at how do we provide excellent care, not so much how do we compete.
Yeah, and we've worked with you on other collaborative projects, and we've just been really impressed at your willingness to all come to the table and address these issues for the community and not just for your hospital, so I think that's terrific. And Pam, I guess I'd just like you to comment on if the patients feel like it's a different experience for them. Are they feeling like, wow, this is really a good way to take care of cardiac patients in our community?
It is. Things kind of transpire rather quickly once they get to the emergency department, so we really try to focus right on them for a minute and say things are going to move quickly, and this is to save your life and your muscle and your heart, and so things do, I mean, they move fast, and patients it's a whirlwind to them at times, but it's definitely for their benefit of their life.
It's amazing. It's happening every day in our community. A lot of us who aren't in the midst of the direct care, we don't always think about what's happening every day in these ERs, so you guys do great work. So what's next between the two hospitals? Are there some other things that you're thinking about working on or some new ideas that you have?
Well, I think currently we're not working necessarily so closely with as hospitals, although our stroke care is very consistent throughout the city. So although we haven't had a focused effort of meeting together to talk about stroke care, we have worked very closely with EMS, Lincoln Fire, in developing protocols for what we do for the stroke patient, and really the same process works. Lincoln Fire meets the patient at their home or wherever they may be having a stroke. They do an assessment, they call us, let us know we have a stroke alert, and again, we have the teams all coming together before the patient even gets to the hospital. So our EMS system, whether it be Lincoln Fire or Lancaster County Rural Squads, are doing an excellent job of assessing, preparing us so that we can better prepare for our patients and make sure that we're providing excellent care and saving lives.
Terrific. Well, it's always been a delight to work with both of the hospitals and to watch you working together and to be able to bring these new things to Lincoln to help take better care of all of us. Well, thanks very much for being here. That was terrific, and it's always exciting to hear about what the hospitals are doing, especially as they work together to create a healthier community. So thanks for being here very much. We're going to be back in a minute with a really exciting opportunity. We're going to have a chance to talk to a heart attack survivor, someone who has benefited from this new technology in Lincoln. So we'll be right back.
These hands hold tight. These hands love. These hands support. These hands create. These hands save lives. To empower your hands to help make a difference, call the American Heart Association at 877-242-4277 for a CPR class near you. These hands are wise.
Well, we're really excited today to talk to Pastor Paul Peterson. He is a heart attack survivor that has benefited from this new technology that we've just been talking about. And so welcome, Pastor, and thanks for joining us today.
Well, thank you.
You recently had the unfortunate experience to have a cardiac event, but you were fortunately able to be the recipient of this new technology. So first of all, tell us just a little bit about yourself so we can learn a little bit about you.
Well, I've been a pastor mostly in Nebraska, but also in Colorado for a little bit. And well, for 40-some years, and been retired now for a few years, and so I basically right now I'm working with Sudanese within the community and throughout Nebraska.
Oh, super. And you live here in Lincoln with your family.
Mm-hmm.
And so recently you had a cardiac episode. So can you tell us just a little bit about that?
Well, last Thursday evening, I was sitting in my bedroom, or laying in my bedroom with my granddaughter, and all of a sudden it just really hit me, and I felt the pain in my chest and my back, and much stronger than what I normally have. And I told my granddaughter, I said, run and get Grandma quick. And they came and they said, well, you know, what do you want to do? You know, should we take you to the hospital? I said, you better call the rescue. So they called 911, and within a few minutes, they were there, and all of a sudden there was 7 guys all around my bed from the rescue unit and the fire and everything else, trying to get everything hooked up and take an EKG and putting IVs in and everything else.
Now, did you know at that time that information was going straight to the emergency department?
No.
But on the ride there, and then you arrived at the emergency department, and they were ready to spring into action. There was a team there ready to take care of you.
Yep.
Can you tell us about that?
Well, on the way, they told me, you know, that this is all being sent to the hospital. And as soon as we got there, they wheeled me into a room, and basically all they did was cut my shirt off and everything else so they could get all the things that they needed. And immediately we went into the cath lab, because my understanding was that the EKG showed that there was a heart attack that was happening. And so they took me immediately almost into the EKG, or into the cath lab, and from there they went through the procedure.
Okay, and
Yeah.
so it happened just like a seamless process. There was no having to stop and look at certain EKGs. They just knew when you got there what they needed to do, and they took
Yep.
you right in. And so this has not happened too long ago. And what are you feeling now? How are you feeling, and what do you think
Well,
the outlook is here?
I'm feeling pretty good.
Good.
And they said it's going to take, you know, time to take
Sure.
it easy
Yeah.
anyway. So I feel very lucky,
Yeah.
because basically they told me, the doctors told me, that if it hadn't been for that, I probably wouldn't have made it. And
Super.
so I feel very lucky and been very blessed by the materials and things that they have that can do that. And I really want to say thanks to them for that, because it was really great.
Well, I know they appreciate that, and I think it's terrific to be here today and hear the whole story, back from when the hospitals first started talking about doing this to getting it implemented, and now seeing right here in the chair a result of that technology and how it's benefited. So thank you so much for coming and sharing your story. We wish you absolutely the best health and a wonderful as you move forward. So thanks for sharing your story with us.
All right, thanks so much.
We will be right back with a demonstration from the field of this new technology in Lincoln.
The pain will not control us. It will never break us, define us, or keep us still. Because arthritis can't beat us if we beat it first. In the fight against arthritis, you need a weapon. What's yours? Visit the Arthritis Foundation at fightarthritispain.org.
Welcome back to Breaking Ground. I'm Lincoln Fire and Rescue Division Chief of EMS Roger Bonine, and I'm in the back of Medic 25 with Captain Kurt Faust and Tin Dang, firefighter paramedic. We're giving you a short demonstration of our 12-lead capabilities. Lincoln Fire and Rescue began transmitting 12-lead EKGs with our LifePak 15s about 18 months ago. We transmit into a 12-lead system through LifeNet using cellular data technology. What that means to you is we'll come to your house when you're suffering chest pain or heart attack, and we'll take a 12-lead, just like they take at your physician's office or at the emergency room. We get a tracing of what your heart is actually doing at that time, and then we can transmit this to the emergency room where the ED physician can look at this. What this also means for you is the ED physician can activate the cardiac cath lab. That means when you get there in the back of an ambulance, you may bypass the emergency room and go right to the cath lab if you're having a cardiac event. This EKG can be read in the field, looks just like this, and we also have the capabilities of sending that to the emergency room. The emergency room physician can overread that 12 lead and push it out to a cardiologist so that they can see it on their smartphone. This technology is amazing for any city, and we've had some fantastic luck with this. The door to balloon time or deployment of first device time on the average is 90 minutes. Here in Lincoln, we've dropped our average below that considerably. Some of the cases have been less than 30 minutes. Breaking Ground will be back after this brief message.
Today, you could save a life. We know that when emergency vehicles are approaching, it can be alarming, and remembering what to do may escape you. Whenever you see and hear lights and sirens of an emergency vehicle, move to the right of the road and stop. Wait for all emergency vehicles to pass. It may be one of your family or friends we're going to assist. Please help us to arrive quickly and safely, and remember, today, you could save a life.
Thanks for joining us today on Breaking Ground. We hope that you enjoyed the opportunity to learn about some innovations that are happening in our community. We'll be back with other stories in the future about these kinds of things that are happening all across our community. In the meanwhile, if you'd like to visit our website for the Community Health Endowment, please visit www.chelincoln.org and read about the many exciting things that are happening.